In this video, we introduce you to the most effective physiotherapy treatments. TENS is also known as transcutaneous electrical nerve stimulation. We use this electrical stimulation method especially in musculoskeletal pain. Sometimes we combine TENS treatment with red light therapy. Combining these therapies give more satisfying results in pain reduction. Cupping therapy helps with stiffness pain, inflammation, and blood flow. Cupping is an old technique that dates back to ancient Egypt. The dry needling technique helps treat the trigger points between muscles. The needles stimulate your muscles and make them contract or twitch. It relieves pain and improves the range of motion. This is a massage gun. It uses percussive therapy to deliver rapid bursts of focused pressure to a specific area. This type of massage helps relieve muscle pain and stiffness, increase blood flow and range of motion, and improve recovery time. Kinesiotaping is an effective technique that helps facilitate muscle function, stabilize joints, or prevent muscles from contracting improperly. Also, it can relieve pain, swelling, and muscle spasm. The intermittent pneumatic compression device helps blood flow and musculoskeletal pain by stimulating the circulatory system. Ultrasound therapy reduces musculoskeletal pain by helping tissue fluids flow better. Here is a collage of some different physical therapy methods.